Hey, what's up friends? In this live demo, we're going to administer local anesthesia on an upper posterior tooth. The methods are very similar to how we anesthetized the upper anterior tooth, but what's a better way to reinforce a concept than through a live demo and through repetition? Also, the same protocol is used for anesthetizing premolars or any upper tooth for that matter. So without further ado, let's head into the operatory. Alright, Power Up Endo Nation, let's provide our bulletproof anesthesia on an upper posterior tooth. We're going to get our patient's tooth number 14 numb and ready for treatment, but this technique is essentially the same for any premolar tooth as well, so keep that in mind. Remember to let the topical anesthetic sit for a full 2 minutes. During this time, ensure your patient has no contraindications to epinephrine and check what your assistant has loaded into the syringe. Remember, we are going to deposit 1.5 carpules of septicane for the buccal infiltration and half of a carpule on the palatal. Look at the crown and visualize where the MB and DB roots are and insert your needle near the apices. You'll want to make sure to insert the needle pretty close to the hub to reach in most cases. Remember, patients love the wiggle distraction. Slowly deposit the entire first cartridge of anesthetic over 10 to 20 seconds. Remove the needle and reload your syringe with a second cartridge of septicane. Then go back in on the buccal and deposit half of the second cartridge. Now take out the needle and proceed to your palatal infiltration. And have your assistant pass the frozen Q-tip. Remember, the flatter you have your patient lying, the easier time you're going to have. Freeze the tissue a few millimeters from the gingival margin on the palatal, then move the Q-tip over a bit while continuing with some pressure. Insert the needle while still applying pressure and deposit your final half cartridge of septicane. Don't forget to allow the anesthetic to settle in for 5 minutes and take this opportunity to schmooze with your patient a bit if you want. After 5 minutes, if you're dealing with a vital case, confirm that they're fully numb with your cold test and you have the green light to get to work. There you have it, friends. Remember, this universal technique of administering bulletproof anesthesia can be used for any dental procedure, and I know you're going to have success with it. I'll see you in the next lesson.